The bird flu is making headlines locally and across the country. In Kenosha, a flock of birds now detecting the virus. The first human case in Wisconsin has also been reported. That was in Barron County. In Louisiana, the first severe human case has now been reported. And in California, there's a state of emergency. The governor there declaring that just on Wednesday. Talking about all of this is Dr. Bill Hartman, a clinical trialist at UW Health. Good afternoon, doctor.
Thank you.
So let's talk about this. When we first started hearing about bird flu, the understanding is that this is just contained to birds, and now it seems to be escalating, jumping species.
Right. So the bird flu really since March has jumped from just being in birds to moving into cattle and to other animals. Usually it kind of runs into a dead end, but in this case it hasn't. There have been at least 61 human cases in the United States, several more throughout the world, including severe case now in Louisiana, the first of the severe cases that we've seen in the United States with a certain type of the H5N1 virus called D1.1. And so this is actually a very similar clade to the virus that caused the severe illness in the young child in Canada as well. And so two of these now, it's worth keeping our eye on the H5N1 as it's moving its way here into Wisconsin to make sure that we don't get these severe cases. But it's also something that we should just keep an eye on nationally. In California, where they are one of the largest producers of milk for our nation, about 600 of their cattle herds are infected, and so it's something that's moving quite dramatically through their state to the point that they've had to do this state of emergency.
Doctor, my concern is maybe people have it and they don't know it. Is that a valid concern?
It is, because it's an influenza A type virus, and so it is a virus that causes things similar to the common cold. Certainly it can progress to something much more severe, as they're seeing in Louisiana. But for many people, they'll probably experience things that they would have at this time of year, including a runny nose, a sore throat, muscle aches. So it's difficult to know. If you have these symptoms and you've been around particular flocks that have been infected with H5N1 or dairy cattle that have been sick, then you probably should get tested.
So two big questions. Do we know of any human-to-human transmission? And secondly, is this considered in the class of coronaviruses, or is this something completely different?
This is something completely different than what we saw with COVID. This is an influenza A virus, and so similar to the flu virus that we get our boosters for every year. We don't know of any human-to-human contact cases at this point. It's something that is constantly under surveillance so that we can make sure that that isn't happening. But it's something that we are worried about. It's something that could happen in the future.
Dr. Hartman, thanks for the insight. And if I don't speak to you again, have a happy holiday.
Thank you.
Yeah.
Same to you.